Today's video is not for the faint of heart, because today we are talking about parasites. My name is Rachel, and I'm a nurse practitioner who's passionate about health and healing the body by finding the root cause of disease. We've been led to believe that the modern sanitation and water treatment protocols in the United States have eradicated parasites in our country. But the truth is that parasite infections are more common than we realize. Parasites can contribute to and be the cause of many health conditions. Other countries realize the prevalence of parasites in their societies, and they treat children regularly for parasites. We know how parasites are spread from one person to another, so it shouldn't be surprising when it actually happens. I've often marveled at the lengths other practitioners will go to in order to deny the presence of parasites in our society. I've actually had family members bring stool samples with visible intestinal parasites directly to the doctor, and the doctor will deny the presence of the parasites or say the test is inconclusive. There are many different types of parasites. Some of the common parasites include hookworms, roundworms, pinworms, and tapeworms. There are also parasites that are so small they can only be seen with a microscope. Today, I'm going to talk about how it might be possible and even likely that you are suffering from parasites, how traditional testing often misses parasites, and what is the best way to get rid of parasites. First, what are some of the signs that you may have parasites? Some of the more obvious symptoms of parasites include digestive symptoms such as bloating, gas, cramping, diarrhea or constipation, and nausea and vomiting. However, parasites can cause symptoms in other areas of the body as well, including fatigue, skin rashes, allergies, asthma, and other lung symptoms, anemia, headaches, joint pain, anxiety, insomnia, teeth grinding at night, nightmares, and intense cravings for sweets. It is also important to note that parasites may be present without causing any symptoms at all. Just because the parasites aren't causing any immediate symptoms doesn't mean that they aren't causing damage in the body. Parasites produce toxic byproducts that interfere with the action of digestive enzymes and can result in difficulty absorbing nutrients. Parasites can also hold on to pathogens and toxins and continually release them, making the body toxic again and again. This makes it difficult to get rid of Lyme disease and other bacterial infections. In other words, it is nearly impossible to truly get rid of infections, heavy metals, and toxins without treating parasites first. So maybe you have some of these symptoms and you think you might have parasites, but you want to know where you got them. Where do parasites come from? Parasites can spread from one person to another or from animals to people. It is no secret that wild animals, farm animals, and pets can get many types of parasites. That is why most people treat their pets regularly for parasites. And yet, they rarely treat themselves or their kids. The feces of infected animals can contain parasites and parasite eggs, which infect nearby soil and plants fertilized with manure. So people can get parasites from eating unwashed fruits and vegetables, and from eating rare or uncooked meats. People can also get parasites from walking barefoot in soil or sand infected with parasite larvae, which are young parasites. Parasite larvae can penetrate the skin in the feet and then spread to other areas in the body. It is also easy to get parasites from pets. For example, dogs will lick themselves and pick up parasite eggs, and then lick your face and transfer the parasites to you. Once one family member is infected with parasites, it is easy to catch the parasites by living in the same house and sharing a bathroom. You can also pick up parasites such as pinworms from public restroom seats. Parasites can be picked up during international travel in places where there is poor sanitation, especially through food and water. It is unclear how common parasites are in the drinking water in the United States, but you want to make sure you're drinking filtered water. Parasites are also more common in children and puppies because of their immature digestive systems and decreased amount of the acidic hydrochloric acid in the stomach, which can kill many parasites in adults. So, once parasites get into your digestive tract, is it possible for them to travel to other areas of the body? Can parasites actually be in other organs besides the intestines? The truth is, once parasites are in the intestines, the eggs or larvae can be absorbed into the bloodstream. Once they're in the bloodstream, they can travel anywhere in the body. The eggs hatch and can migrate to other areas. Once in their new location, the parasites can continue to grow in the tissues in that area. If parasites are so easy to catch and so many people seem to have them, why aren't they diagnosed more often? How are parasites diagnosed in conventional medicine, and how accurate are these methods? The most common test that is ordered for patients suspected of having parasites is stool testing for ova and parasites. The problem with this method is that if the parasites or parasite eggs are not present in that particular sample, the test will come back negative and the doctor may assume that you don't have parasites. Sometimes doctors will collect multiple samples on different days, and this will make it more likely that they will catch the parasites, but it is still common to miss them altogether. The reason for this is that parasites are shed at irregular intervals, and they are not even in every bowel movement, let alone the particular sample that is tested. There are also blood tests for parasites, but no one test will check for all types of parasites, but only for a particular species. Alternatively, my favorite way to test for parasites is through muscle testing. Muscle testing is a way of evaluating the body and the subconscious through reflexes. Your subconscious logs and records everything in your life, including viruses and parasites, and it is just a matter of accessing that information. Muscle testing is a quick and non-invasive way of knowing if you have parasites that are affecting your health. Once you determine whether or not you have parasites, the next step is to treat them. Conventional medicine uses a variety of medications, such as albendazole, ivermectin, and parenteral, depending on the type of parasite. However, these medications often come with side effects, such as rash, dizziness, headaches, abdominal pain, nausea, vomiting, and more. A mistake that is often made in traditional medicine is not treating long enough or repeating doses, and the parasites are not effectively killed off or may come back when more eggs are hatched. The natural treatments that I use for parasites are supplements that are non-toxic and don't have side effects. They are used for longer periods of time and are more effective. It can take a couple months to over a year to completely handle parasites. Some of these supplements include wormwood, garlic, and herb combinations from the company Cellcore. Another trick that is used to rid the body of parasites is to cycle the supplements by taking them for 10 days, stopping them for 5 days, and then repeating the process. Or for some supplements, taking them for 3 weeks and then taking a 1-week break. This increases the effectiveness of killing both the parasites and the parasite eggs. During a parasite cleanse, you should focus on eating healthy foods, such as whole fruits and vegetables, grass-fed meats, nuts, and seeds. It is best to avoid sugar and refined carbohydrates as much as possible because parasites love sugar and thrive on glucose-rich blood. Once you get rid of parasites, you want to make sure you avoid getting them again. What are some ways you can protect yourself and your family against parasites? First, cleaning up your body and strengthening your immune system is a good start. The immune system is capable of protecting against parasites and even getting rid of them without help if the body is not unbalanced or overwhelmed. The problem is that most people are overloaded with toxins or chemicals or pathogens that weaken the body's defenses, and the immune system is not able to do its job effectively. There are some practical things you can do to protect yourself against parasites. First, wash your hands after touching animals and pets, and try to avoid letting them lick your face or mouth. Don't walk barefoot in areas where there are animal feces, such as the chicken pen or fertilized fields. Wash raw fruits and veggies with a vegetable wash or with a little bit of white vinegar. Only eat properly cooked meats and avoid raw meats, even fish. Keep your fingernails clean and avoid biting your nails. Be careful when going out to eat, especially at salad bars. So, although parasites are more common in the developed world than we have been led to believe, it is possible to get rid of them naturally and without toxic medications. There are steps we can take to minimize our risk of getting parasites and passing them on to others. I hope this video has been helpful and that you can use this information to help you and your family move toward wellness.